morning, good morning, good morning, good morning.
Good morning.
Thank God it's Friday.
Friday.
Thank God it's Friday. Oh my God. I think I've been waiting for this day all week.
Yes.
Huh?
Marek, you know what? This week would not be as perfect as it is if Friday didn't come at the end of it.
That's right. And that's what I'm talking about. And so, you know how we do. We always say thank God it's Friday because when Friday hits, what do we have? Yeah, we have another edition of the South Carolina Community Live Podcast.
Yes. There you
And
go.
I'm one of your hosts. I'm Mark Calhoun. I'm the Director of Social and Community Service. I'm always here with my partner in crime.
Daniel Myers, MATHD Program Director, as well as the R Corp Consortium Program Director. Yes, sir.
And
Yes, sir.
we couldn't put all that on the title.
No.
He'd have his own podcast.
Yeah.
If we put all that on a but
Yes,
yeah,
sir.
thank you everybody for joining us again for another podcast here on this wonderful Friday. We have a special guest on the show with us today. Some of y'all know that open enrollment for the ACA started on Monday, November 1st. And we have this guest here. She's going to walk us through and talk about the ACA. We're going to talk about a little bit about what plans that are available for us here in the PD area, what changes may have came about for this year's open enrollment period. So without further ado, I'm going to turn it over to our guest. She's going to introduce herself, and she's going to give us some of this good tea, this good knowledge that she has in store for us.
Yes.
Thank you. My name is Sonia Donnelly. I'm with the Palmetto Project. I've been there for a few years now, so you might recognize me or you might not. I have no snazzy opening, but I can strike my super Asian pose, which is this one. That's my usual super Asian pose. So,
all right.
Affordable Care Act, that's what we're here to talk about today. I don't know if you guys know much about it. It's been around for a decade already.
Oh, wow.
Who'd have known, right? It seems like it was just yesterday. But the goals were threefold. Number one was to create some sort of health coverage system that would cover from birth to elderly, right? Particularly trying to get people covered who were at the federal poverty level, from 100 to 400% of federal poverty level. The second was to expand Medicaid. Haven't quite done that in South Carolina just yet, but maybe one day. And that's expanding it to people who don't have children, who are single, who don't have any type of disability or anything like that to get on Medicaid. So there's a few people who fall in the gap right now that don't quite qualify for Marketplace. They don't qualify for Medicaid, and they get stuck in the middle. I'm sure you guys see a bunch of those folks. And then the third was to try to lower healthcare costs in general. So what types of things, technology-wise or pharmaceutical-wise, or the way that billing is done, all of those things, what could we do to get those costs lower? I think we're still working on it. I think some people would say it's successful, some people would say it's not. But I think the best thing that we've seen is this creation of the Marketplace, which a lot of people know about. That it's a type of health insurance. People call it all different types of things. They call it Obamacare. They call it Trump care. They call it Biden care. And I always say, I don't care so long as you go to the doctors. I don't care what you call it. Just get yourself some insurance, get yourself to the doctors, make sure that you get checked out, because there's no point having any type of health coverage if you're not going to see and have a medical home where you can see a primary care physician, get all your stuff taken care of, get those chronic conditions maintained, so that you are on a stable playing field when you go out there. And it affects so many different things, right? School, work, the way that you can travel and transport yourself to get to places, your stamina throughout the day. So healthcare is just really important to us, and the way that we access it. We want people to be able to access affordable healthcare. That's primary care as well as specialty care. And marketplace health insurance helps us do that. The Affordable Care Act did a lot of different things. It let us keep kids on insurance, just any insurance too. And I think sometimes people don't realize that is that the Affordable Care Act isn't just about marketplace health insurance, but it's also for all health insurance across the board. They said, hey, you can let your kids stay on until they're 26. I think that's pretty cool.
Yeah.
The other thing that they said was that you can't just willy-nilly decide that people have pre-existing conditions and you're not going to cover them. No, when my first child was born, she was premature, and at the time, a preemie baby was considered premature birth was considered a pre-existing condition, and it really worried me. I was like, what am I supposed to do? Am I supposed, like, when she ever switches coverage, she's never going to be able to get covered? Like, it just was confusing, and I didn't know how it worked. And so the Affordable Care Act took some of that fear away for me personally. And then other things like there's no maximum on these marketplace plans or health insurance. They can't just say, oh, we're going to cover you up to $2 million and then bye, get off because you've spent too much money. Now they can't do that. There's no maximum limit to how much people can be charged. And then also this extra protection of personal health information, that they're going to lock it down a little bit better. There's some security. There's a lot of different measures in terms of what you can share and what your physician can share with other people too. So I think that's like kind of the big overview of what we've got going on. Any particular things that you want me to address from there?
So I know also, as part of the Affordable Care Act, one of the things that affected us, it almost mandated that we automate it, right? We make that switch from paper charts to electronic medical record.
Yeah.
Yeah,
Yeah,
and I
that was
think
a huge one.
yeah, and I think it opened up healthcare in a way that just kind of made us more efficient. You know what I mean?
Mm-hmm.
Put information to your fingertips. And now, we're looking at how, and they just need some work, and they're working on it. How we can more connectivity to be able to connect to other providers to have that information when you're treating a patient.
Yeah.
Daniel being a nurse, he can appreciate that because he works with that EMR system quite a bit. To being able to reach into, know that patient went to this particular doctor for this same thing and having access to that information through some type of exchange.
Yeah.
You're mute. You're mute.
Sorry, because of them mandating the EHRs and the electronic health record, it also opened up a place for data. So we have a data set that we can use to track people who don't have insurance. Also, those that do have insurance, make it easier for them to even verify at the time of appointment. And if we find that they have a lapse in coverage, then we're able at that time during this period to get them into coverage if something happened during the last 12 months where they missed it or they lapsed or anything like that. So that was really beneficial, and it's helped us to track conditions, pre-existing conditions, all of that, and like Marek said, even reach out into other services so that we can have a uniform, when it comes to uniform services for those patients that need it, we can join them with other avenues of care. So even in Marek's instance, it helps them also with those social determinants of health, which can help them. We can track those as well through a form that we have in our EHR.
Yeah, it's now become that social part of it become part of the electronic the record. Where in the past in paper charts, we didn't write notes and put them in the charts like that.
Yeah.
So
I think it does allow for a much more fuller view of what's going on with someone. And it's not just a person with numbers on a chart and, lab results on a chart, but it's like, where does this person live and where do they go in terms of where do they hang out and what are they doing? So I think more efficiencies in that way. I like that there's more transparency and it's more real time. You're not waiting for hours for this piece of floaty paper somewhere in someone's office. I mean, that's got to be a nightmare. I remember going down to the hospital. I had to pick up medical records. It took me weeks. And then she had to go back and I was like, what is going on? Why is it taking so long? So I think it's done a world of wonders in terms of moving us forward in technology.
as well as security, as well as
Security,
security.
yeah.
Mhm.
So
Yeah, you're
Absolutely.
right.
Absolutely. Well, Sonia, if you could discuss with us, touch on us, what do we see new as far as plans this year, or even what type of plans are we seeing in exchange? Like I say we're in the PD region, so
Yeah,
Pacific to our area. What kind of plans? What not necessarily specific to our area because our reach goes beyond the
yeah,
PD region, but what kind of plans do we see on the exchange this year?
yeah. There's 4 carriers in South Carolina this year on the exchange. So that's Blue Cross Blue Shield of South Carolina, Ambetta, Molina, and Bright Health. So those are the 4. The 3 that you'll see in your area are Ambetta, Molina, and Blue Cross Blue Shield. So Bright isn't covering your area, but it is in other parts of the state. So got to know about them. I think what you'll see is that the prices differ county to county. So, your friend in Florence isn't going to have the same price as your friend in Darlington or, your friend in Dillon County. Like they're just going to be different. And sometimes we get calls going, "Hey, Paul up the street has this plan for $20. Why is mine $80?" And it's because the carriers have different price structures and they have different plans available in the different counties. Um, the the lowest cost silver plan is the one that dictates how much premium tax credit people get. And the premium tax credit is that financial assistance piece, that subsidy that helps offset the price of the premium. So if the premium is $500 and I qualify for a premium tax credit of $400, then monthly my payment is down to $100, right? So unfortunately, that's dictated by whoever came into the market with the lowest cost priced plan. And sometimes that lower priced plan might not be the one that you want. So it's really important to look at, what's going to work for your pocket in terms of the price of the premium itself. Then, does it cover your medications? Does it cover the doctors that you want to see? Is it going to work for you in terms of the services that you want? So we try to make sure that people understand that there's just a few different things. Don't just look at that little monthly premium. Think about how much it's going to cost you to actually use it. There's no point having insurance if you can't use it. Um, so we want to make sure that people have something that's accessible.
Absolutely, absolutely. You talked or you mentioned the sliding fee. You mentioned 400 percent um of the poverty level. Could you explain that to the folks out
Yeah,
there? And because in the past there was a ceiling there, right? Could you
yeah,
explain
yeah.
that to us?
Yeah, so one person federal poverty level for 2022 is 12,880. So before, what people used to do is when they hit the 400%, which is that 12,880 times 4, when they hit that for income, they would just not be eligible for any type of premium tax credit. And that's changed in the last couple of years with just changes in the how the premium tax credit is calculated. It's changed for 2021 and 2022. The hope is that it'll just continue into the future. They've got to make sure that that passes into the future. But it means that people who are used to be right on that edge where they thought that their income was too high to get anything should check the marketplace because they might be eligible for a little bit of premium tax credit. And it might not be a ton, it's not going to be bazillion dollars and take down your plan to $20 a month. But it's going to be where it's not any more than 8.5% of your income, the premium itself. So they've capped that so that you can't just be paying extortionate amounts of premium, so that you can make it more affordable. But it does mean that anyone, usually like people who would be over that 400% level, we'd say, oh yeah, you're over, you just got to buy a full price plan. And that's not always the case. Sometimes they can get something that's quite affordable. Bronze plan, it might be a high deductible, high out of pocket plan. But there's just more options to look at. So I wouldn't count it out. I'd definitely check to see what's available on the marketplace.
Yeah, so I know we've been encouraging some of our folks to not automatically re-enroll and to have those conversations with the counselors because of the changes that have been there
Yeah,
this year. Um,
yeah. There's a few different plans. Like Molina has a new Silver 7 plan. So if you're on a Molina plan that's a silver plan, you might want to look at it. Might want to look at the change. The prices have changed too. Ambetter's got a ton of different plans out. Um, so it's worth looking at those. There's a couple with lower deductibles. There's a couple that are really affordable and look really nice in terms of deductibles and out of pockets. And sometimes when you just renew, you're going to be surprised because maybe you were paying $20 and that plan might be $100 next year. So you definitely have to check. And we always tell people to check. Again, the doctors, medications, hospitals, make sure that the ones that you want are covered by the carrier that you want.
yeah, we had a comment said she wondered why her plan went to zero. She's on Ambetter.
Yeah, so it might be that she talking about the 2022 plan, then it might be because they've lowered their prices in terms of them being lower. Um, and then what happens is it increases the tax credit. So then things are like that. Um, Yeah, deductibles can be high too, in terms of it just depends on which plan. There's a couple of plans that have a little bit lower deductible, but then you end up paying a little bit more in premium. So it does take a little bit of comparison, and that's why you want to contact these folks with their assisters and navigators because they look at these plans every day. So they're looking at these plans, they know the plans, they know the deductibles and the out of pockets. They can easily help you figure out your income, your household size, and they can walk you through the whole process and help you make those decisions, figure out what your priorities are in a plan. That way, you're not missing anything and you're really understanding what it all is. Health insurance is so complicated sometimes, and assisters and navigators are great because they really make it much more simple and they don't talk to you like you're stupid and like you just don't understand it. I mean, it's just complicated for everybody. So we can make it easy.
Absolutely, absolutely. Um, so, is there anything that stands out with the three plans that are in our area that folks should be aware of? I know we kind of went over them, a little bit. Is there anything that stands out for the three plans that or maybe an incentive for the patient or the individual out there
Yeah,
outside of the tax deductible?
I think with all three, they all three have a very long history in South Carolina. So of course, Blue Cross Blue Shield of South Carolina has been around forever. They're really stable. Everybody likes their customer service. They're local, so you can access them really easily, and the plans are solid. They cover all hospitals in South Carolina. Um, they can be it just depends on where your income falls as to whether it's going to be something that's going to be affordable. So you got to check them out. Molina is growing all the time. Molina is known across the state for their Medicaid managed care services, and so they've been around for a long time. It's not like they're new and they don't know what they're doing. They're really solid. Again, they're going to have a more narrow network than Blue Cross potentially. So you do want to check your doctors and check your hospitals and check medications and things like that. And then Ambetter's the same way. Ambetter's got a pretty decent footprint, and Ambetter's also well known. They just are known by a different name. Their Medicaid is Absolute Total Care, and their Medicare product is WellCare. So you might be like, who are they? But they've been around for a really long time too. They know what they're doing. They have some great customer service too. So I hesitate to say too much about a particular plan because plans look so different depending on what income level people have, and then what their priorities are too. Um, Same thing for carriers. Some people prefer a particular carrier, and some carriers just aren't going to work for some people. Maybe there's a doctor that is only available with Blue Cross, and you have to have that doctor. Then, in which case, you know where you need to go, and you got to figure out, is it going to be something you can afford? Um, so again, I point people to those assisters and navigators to help them figure out which plan is going to be really the one that's going to work for them.
Gotcha. We had a question come through. Want to see they just completed application for a patient. Their yearly income was around $5,000. She did not
Yeah.
qualify for the tax credit, but the health insurance, but needed
Yeah.
health
So
insurance. Yeah,
so
you said.
that's that coverage gap that we talk about, where they
Mhm.
don't quite qualify for Medicaid. If we'd have expanded Medicaid, she'd be covered for that. Um, but she doesn't qualify for Marketplace because the annual income is 12,880. So what people don't understand sometimes is they're not looking at last year's income or this year's income. They're looking at predicting what that person's going to make in 2022. So if she thinks that she might get a little part-time job or something that, or maybe she's looking for a job and she usually makes X amount of money, then that's something that you might be able to predict that she's going to make more than that 12,880. Um, so then you want to kind of look forward a little bit in terms of putting that onto the application. Now, if they say, you know what, I make $5,000 and that's all I make, I don't have DoorDash, I don't do babysitting, I don't do house cleaning for my kids, and they pay me. There's nothing like that I can do. And then unfortunately, they fall in a coverage gap, and that's where places like you guys come in terms of finding a sliding scale clinic or um, those federally qualified health clinics, free clinics. It's a bit of patchwork in terms of being able to find specialists and medicines and everything like that type of thing covered. Um, but that's why then we have to push for potentially Medicaid expansion at some point. Talk to our elected officials and make sure that you make your voice heard in terms of what you want for healthcare in South Carolina, because it does mean people like this with that income in the middle, they fall into a gap and they get forgotten.
Absolutely, absolutely.
Yeah.
Yeah. Uh, she said, "How do you contact Navigator? If you can go to any Care South Carolina facility, and we have certified application counselors there that can assist you with um, signing up for an ACA plan. We also do have a navigator. Her name is Jackie Anderson. She actually works out of Marlborough County, but she's can assist in all 5 counties. And you can reach her at 843 703 9002. And she can assist you there. But you can also go, like I said, any Care South Carolina building center and get assistance with ACA. Absolutely. So, what about the small businesses? What's out there for them?
Yeah. They do have they tried to prop up this what they called shop, which was for small businesses. And they were kind of like little group plans for small businesses. But I don't think that it quite worked out, not at least not in South Carolina. So what small businesses have, or they can still look at a group plan. But what small businesses don't often understand is that when you offer health insurance to employees, it's not because it's going to be cheaper for you as an employer to have health insurance. A lot of times it's because you are providing it as a perk and you're actually putting out more money because you're saying, I'm going to pay most or at least a big portion, at least 50% of their health insurance and then some, right, to make it affordable. And then I'm going to offer this to the employee. So it's great for the employee, but for the employer, it's actually quite expensive. So a lot of times what we do with small businesses is we tell them to connect with navigators, assisters to help each individual employee get the health insurance through the marketplace and look at, is it something that, you know, they may already have health insurance through something else. But a lot of times they can look at the marketplace to see what's available and see what's available to them. There's also some different options with what they call like health savings types of accounts, where they can give employers can give employees like a little amount to cover medical stuff, but it messes with the marketplace tax credit a little bit. So if someone's already in a marketplace plan and then they get offered this, what they call ICRA or QSERA, there's like a acronym, but it's like some sort of health savings account type of thing. If they get offered it through the job, it offsets the credit that they get on the marketplace. So sometimes it can make them ineligible for the marketplace, and then that way, then they're just stuck with something really expensive. So I would always tell people, if there's a small business and they're looking at it, definitely they can call Palmetto Project. We're well versed in it. We can kind of walk them through the process, or just look at, especially if it's like a couple, 3 people, I'd look at the individual marketplace, because it's probably going to turn out a little bit cheaper in the end.
Sounds good. Sounds good.
Yeah.
All right. This was some great information that you provided with us today. Anything that you want to touch on before we close out that we didn't get a chance to touch on?
Just that you can, Palmetto Project is statewide. We are supporting the Navigator folks this year with scheduling appointments. I love you guys at CareSouth. You guys have been some great partners in the past and now moving forward. We always can trust when we refer people to you that they're going to get the care that they need, and they're going to get this all around love that I'm feeling from you guys. So we appreciate what you do. And definitely, if anyone's got any questions, they can, of course, call you guys, but also reach out to us if they need anything.
Absolutely, absolutely. And how do they get in touch with you?
They can go straight through Facebook or social media. So at Palmetto Project, you can find us there. They can call us. We're based out of Charleston. We cover the state. It's 843-577-4122 is our main number.
Absolutely. And same here. If you want to reach out to CareSouth Carolina and we can assist you, you can reach out to us at 866-498-0399, or you can check us out on our website, www.caresouth-carolina.com. See us on our social media pages, Facebook, Twitter, and YouTube at CareSouth Carolina. We appreciate you joining us today, Sonia. Thank you so much for joining us and
no problem.
Giving us this wonderful information.
All right, Super Asian close out, right?
Yes, ma'am. Yes, ma'am. And again, how can they reach you again? We like to give you another opportunity to get that out there.
It's Palmetto Project. You can look us up on Facebook. We're on Twitter. We have a not so exciting as CareSouth's YouTube page. And our phone number, 843-577-4122.
All right. Thank you so much. And just right before you go, there's a question we always like to ask the guests before they leave.
Right.
We think it's one of the most important questions that we can even ask them. So when Sonia is not doing Palmetto Project, what is Sonia doing? How does she unwind and enjoy her weekend?
Don't know that it's unwinding, but I caught these 2 kids around. My life revolves around this 13-year-old and 9-year-old who happen to have November birthdays. So we're smack bang in the middle of the busy season. So I'm running around trying to keep up with them. I read a lot. I like to go to the movies. I like to go sit in coffee shops, just relax. I'm pretty relaxed most of the time. So.
All right. Well, definitely. We're glad you're relaxed and you got great energy. We appreciate you being on. I think Marvel Eternals come out this weekend. I guess that's the movie for the weekend.
Yes.
Yeah. So that's what I'm going to be looking at doing. So thank you again. Anything you got before we cut out, Daniel?
Yeah, I just want everybody who, if you need insurance, if you need coverage, and everybody do, Go to one of our CareSouth locations, talk to some of our community health workers, and please register for ACA. We don't know when we're going to, we don't know when we're going to need it, but we need to make sure that we have it. It's best to have it and not need it than to need it and not have it. So please go and visit somebody, visit one of us at one of our sites and get registered for ACA. Enroll, get insurance, get coverage, and come see us. If by chance you don't qualify and you fall in that gap, CareSouth does have sliding fees, sliding plan, and we'll be able to get you. We don't turn anybody away, and we will see you. We're not going to say our services are free, but we will help you be seen, and we will help you get your bill paid. Okay.
Absolutely. All right, it's Palmetto Project, CareSouth Carolina Community Live podcast. Y'all have a wonderful weekend.